Hey everyone! Today I'm diving deep into how mechanical ventilators save lives. Now imagine a scenario where a patient can't breathe adequately on their own. That's where mechanical ventilators come into play. These incredible devices deliver controlled breaths to the patient's lungs through either an endotracheal tube or a mask over the nose and mouth. Mechanical ventilation ensures that patients get enough oxygen and can effectively remove carbon dioxide, which is critical for those with severe respiratory conditions. Let's break down the main indications for using a mechanical ventilator. First, we have acute respiratory failure, where the patient can't maintain adequate gas exchange. Then there's chronic respiratory failure exacerbation, often seen in conditions like COPD. Post-operative support is another common use, especially after major surgeries that affect breathing. Neuromuscular diseases, trauma, severe infections like sepsis or pneumonia, and anesthesia during surgery all call for mechanical ventilation. Now let's talk about the types of mechanical ventilators. The most common are positive pressure ventilators, which push air into the lungs. Volume-cycled ventilators deliver a preset volume of air with each breath, while pressure-cycled ventilators stop once a preset pressure is reached. There are also time-cycled and flow-cycled ventilators, as well as negative pressure ventilators like the iron lung. Ventilator modes are crucial too. In assist control mode, the ventilator delivers a set number of breaths with a preset volume or pressure, and the patient can trigger additional breaths. Synchronized intermittent mandatory ventilation, or SIMV, allows for spontaneous breathing between mandatory breaths. Pressure support ventilation assists spontaneous breaths with a preset pressure level, while CPAP and BiPAP maintain continuous or bi-level pressure to keep airways open. Caring for patients on ventilators involves several key aspects: airway management, regular monitoring of vital signs and blood gases, suctioning to remove secretions, repositioning the patient, providing oral care, facilitating communication, and ensuring adequate nutrition are all critical. Weaning a patient off a ventilator is a gradual process. It starts with assessing the patient's readiness and conducting spontaneous breathing trials. Gradual reduction of ventilator settings follows, and finally, extubation once the patient can breathe adequately on their own. But there are complications to watch for. Ventilator-associated pneumonia, barotrauma, volutrauma, atelectasis, pneumothorax, oxygen toxicity, and decreased cardiac output are potential risks. Let's look at a case scenario. Meet John, a 55-year-old male admitted to the ICU after a severe car accident. He had multiple fractures and a traumatic brain injury leading to acute respiratory failure. John was intubated and placed on a mechanical ventilator in assist control mode. Over the next few days, his care team managed his airway, monitored his vitals, repositioned him regularly, and provided nutrition through a nasogastric tube. After 2 days, John's respiratory function improved and he began spontaneous breathing trials. Gradually, ventilator settings were reduced, and eventually, John was extubated and transitioned to a BiPAP machine. Despite developing ventilator-associated pneumonia and partial lung collapse, John's condition improved, and he was moved to a step-down unit for further recovery. Mechanical ventilators are life-saving devices, critical for patients with severe respiratory issues. Understanding their use, types, modes, patient care, and weaning process is essential for healthcare professionals. Thanks for tuning in.